If you had a medical issue that could probably kill you one day, wouldn't you like to know what it is? Wouldn't you like to know so you could be treated or maybe even cured? Everyone would like to live my life to the fullest and fix whatever it is that could potentially harm me. After I graduate college, I would like to become a neurosurgeon. The key to being a successful doctor is to help patients in need. The only way we can do that is by having access to the right equipment. One of the most important pieces of equipment for a neurosurgeon is called a computed tomography scanner, or as many of you have heard, a CT scanner or a CAT scanner. Today I will be telling you what exactly a CT scanner does, the cost of one of these machines, how they are used, and some downfalls it faces. A CT scanner is similar to an X-ray or an MRI machine. It uses radiation to help visualize the human anatomy, showing us a person's bones, soft tissue, and blood vessels all in one picture. The picture is then broken down into slices, kind of like bread. It can either be viewed as the whole loaf or individual slices. This helps us better understand what is going on in a person's body. Medline Encyclopedia says that the scan for an entire body takes only a short few minutes, but now the newest machine that most hospitals use takes about 30 seconds. Now you might ask yourself, what does the patient go through during one of these scans? According to Johns Hopkins Medicine Health Library, the process of getting a CT scan is very simple. An IV is usually inserted in the patient's arm or hand into their vein. Then the patient is given a clear, chalky tasting liquid that they have to drink called a contrast agent. The contrast agent is to flush out the system and preps the patient for the contrast later on during the scan. Once wheeled into the scan room, you lie on your stomach or your back, depending on where the pictures are being taken. The nurse then injects the contrast agent into the IV, and some people get different type of symptoms from this. People either endure a burning sensation, a metallic taste in their mouth, or sometimes no symptoms at all. The contrast helps doctors depict pictures to see if there are any blockages or any bleeding. Next up, how much do you think these things cost anyway? What's the difference, you might ask? The different types of CT machines are usually defined by how many slices of an organ the machine can produce. The cost of one of these machines are pretty pricey though. In 2011, Chief Executive Officer Jill Bowen of Northwestern Medical Center said for one 64-slice machine, they paid out over $528,000. That's over $500,000 just for one unit. But they do make their money back fairly quickly. The average cost of a CT scan per patient is over $1,200, depending on the patient, the procedure, how many pictures are needed, and the body part. Now let's talk about what these scanners can really do. In my field, CT scanners are key. They can help diagnose brain tumors, brain blockages, and even cancer that would not be able to be shown solely based on MRIs or X-rays. It can help a doctor see exactly what the individual's anatomy is, so if they're doing a needle biopsy or any type of surgery, they know exactly what they're looking for and exactly where to go. It can track improvements or changes of the brain that may have happened during treatments or after surgeries. Although this seems great, there are some downfalls to the scanner. According to the National Cancer Institute, radiation exposure can be very harmful to those exposed to it excessively. Too much exposure to one of the CT scanners can sometimes cause an increase or cause cancer itself. I found this pretty ironic because they use radiation to treat cancer. Now you know how much one of these machines costs, the process for what it is, what it does, how they're used, how doctors use them, and finally, what possible downfalls it entails. Personally, I feel that the benefits of using this machine far outweighs the downfalls. There is so much that we can learn to save people's lives just from one machine, and that's the key to being a successful doctor, saving lives using whatever it takes. Now, one more question. If you were suddenly suspected of having a brain tumor, wouldn't you use the risk of the machine to save your life?